Hello, my name's Claire Roantree. I'm a partner at Boyce Turner Solicitors in Reading, and we represent claimants who have been involved in major trauma, accidents, and serious life-changing injuries. I'm joined today by Dr. Matija Krkovic, an orthopaedic and trauma surgeon at Addenbrooke's Hospital in Cambridge, to talk about limb salvage and amputation. Hi, Matija, how are you today?
Thank you, Claire. I'm very good. Thank you for inviting me on this meeting.
So I just wanted to get an idea from you about the types of patients you see. So we typically see clients who've had major trauma. There can be complex fractures or crush injuries, and they need limb conserving treatment. What about the type of patients that you see as part of your everyday practice?
The majority of my patients are exactly as you mentioned. They are people with multiple injuries or significant injuries to their limbs. My practice predominantly consists of lower limb injuries. Either they are open injuries or injuries with significant bone loss, or with significant injuries to the joints, so either knee or ankle joint. And the other part of my practice, which doesn't include acute patients, are so-called semi-acute or elective patients, and there are many patients with either non-unions or infection of the bone. One of the infections on the bone is called osteomyelitis, can be in different stages, and it has been proven to be very difficult to manage.
Yeah, we've certainly come across clients who've had quite significant injuries and where that has been a threat to their lower limb mainly. So what's involved in a typical operation to save a limb?
So saving the limb means that we will restore the limb function to a certain extent. Usually we cannot restore it to the full functional extent as it was prior to the accident, but the closer we can get to it, the better. In the majority of these injuries where patients will require limb restoration surgeries, bone is missing, but soft tissues as well. And the soft tissues, usually they are the skin and then certain muscles. But in majority of the cases, the main problem can be with the skin loss. So we work together with plastic surgeons who will reconstruct soft tissue cover before we can restore the bone. And when the soft tissue cover is restored, and they do this by different ways, either they will use some local tissue or they will take tissue from different parts of the body and put it in the place of the injury. And then usually 4 weeks after, we will start with growing new bone.
Can you give us some examples of the types of complex orthopedic injuries and patients that you see?
So we usually see, as we have divided our expertise, and I would, for example, I would see patients with a lower limb injuries, either tibia or femur. So tibia is lower part of the leg, and femur is bone in the upper part of the leg. And they would have an open injury with a soft tissue loss, let's say 10, 20, 50, or even more square centimeters or square inches. And then they would have a bone loss as well. They can have a bone loss of a few centimeters, or they can have even more than 10 centimeters. On average, or average distance or length of bone defects would be in between 5 to 8, but then it's normal to manage about 10 centimeters of bone loss.
Yeah, it's quite a significant amount. You would think that that would have a catastrophic effect, wouldn't you? But 10 centimeters is about normal, is it?
Yeah, it is normal, more or less, and it's something we are completely accustomed and used to deal with, and we can predict quite precisely how long the treatment will take. Most recently, we are paying a lot of attention to psychological impact and psychological interventions as well during and after the treatment.
The psychological aspect is certainly a huge part of the work that we do. So anyone who's been through trauma is going to experience not just the physical after effects of an accident, but also the psychological. Does that have any barrier to you for recovery?
Yeah, so we are trying our best to keep patients in a good psychological condition, in a good position. We see that the sooner we start with the treatment and the sooner we can finish the treatment, the lower the impact it will have. But in general, we see that we encounter problems up to about 6 months post-accident. We also spend a lot of time of convincing people that they have to stay and remain positive, and they have to comply with the treatment as we believe strongly that limb reconstruction is certainly offering or giving people the same functional outcome, if not better than an amputation.